My name is Morna Murray, and I'm glad that Mike ended on a point of advocacy because that's really how I'm addressing the immense topic of Medicaid today. I know a little bit about you from the people who organized the conference, but I would like to ask, how many of you actually are people personally involved with the rare disease? Could I get a show of hands? Okay. And you suffer or a loved one. Could I say you have one yourself? Okay. Very good. Okay. That helps me a lot. Because as you can see, Medicare and Medicaid are very complex public health programs. Even those of us who have been working in for a very long time, sometimes our eyes glaze over with the complexity of it. And you are all here. I know you're going to be taking part in legislative meetings tomorrow with your members of Congress. And that is something that I've been doing for most of my career, advocating on behalf of populations that are vulnerable. First and foremost, I should add that I'm a parent of a child, an adult child who's on the spectrum, the autism spectrum. And so talking about the fact that it can be very discouraging at times, very difficult at times advocating, and that we're in a marathon, not a sprint, is something to keep in mind when you're here in DC or in your state capitals or whatever it is that you're doing. So I just want to mention that as an overlying theme here. I'm going to just go through some of this very quickly because, to be honest with you, it is important to understand Medicaid. Medicaid is always changing. It's different in every single state. Every state runs its own Medicaid program. It is a federal-state partnership. And it is virtually impossible to be an expert at all aspects. I'm sure there are some people, I shouldn't say that. I personally am not an expert at every single aspect of Medicaid. And as an advocate for rare disease treatments and therapies and funding, I don't think you should expect yourselves to be either. What you are experts in is what you need and your experience in the healthcare system, whether that's positive or negative. And exactly as was mentioned over here, situations like when you're being denied life-saving treatment or medications that are absolutely critical for whatever disorder may be personal to you or a loved one or a child, it is very, very important that policymakers hear your story, your personal story, and it's also important to band together, as you are here, with people who are advocating for the same thing. And I would add to that, this is not on my slides, but I'm thinking sort of out loud as I was listening to Mike, I would add to that in view of what is taking place with Medicaid over the last year and what is coming this year, I'm assuming that all of you are, you don't have to be, but since it's been in the news so much, you're familiar with how much has been proposed in various proposals to be cut from the Medicaid program. Can I ask that? Show of hands, people that are familiar with that. So for those of you that aren't, in terms of attempts to, and I'm not saying this in any political way, in terms of attempts to repeal and replace the Affordable Care Act, part and parcel of those attempts to do so are radical changes to the Medicaid program, because a very large portion of what we refer to as the Affordable Care Act, Obamacare, whatever you want to call it, was an expansion of Medicaid benefits for people throughout the country, and an expansion of other things that affect people with chronic conditions or illnesses or other disabilities or conditions. I'm not classifying rare diseases as a disability, trust me, but there is something to be said for banding with other organizations and groups that are all have the same purpose with respect to Medicaid, which is it can't be cut, it can't be block granted, it can't be allocated on a per capita basis as has been proposed and beaten back last year, because that will reduce what is available to people on Medicaid in states by hundreds of billions of dollars. It's difficult, I think, for a lot of us to even imagine what that will look like were that to be successful. But it is guaranteed that people who are on optional programs in states under Medicaid, such as waiver programs for special populations, which would, in some states, include people that have rare diseases or other chronic conditions or disabilities, children with disabilities. Those kinds of programs that are not required by Medicaid would be the first to be cut under a situation like that. So as an advocate for the umbrella program of Medicaid, I guess my biggest message to you this afternoon, and in a very limited period of time, is to say, don't get lost in all the details of Medicaid, because it's really not the best use of your time. And those of us, again, who are doing it all the time have to work all the time to keep up on what's happening with Medicaid and all the proposals that are coming down the pike right now, including proposals to add work as a requirement for Medicaid. And there are many people in this room, I'm sure, that have difficulty holding a full-time job because of the symptoms and other results of having a rare disease, having a chronic condition, having something that ebbs and flows and makes it difficult to work consistently. So anyway, that's sort of my, I've just departed completely from my slides, and I'm gonna I'm gonna run through this very, very quickly, just to give you the basics. To say, I guess the one thing I'll say is that Medicaid is an entitlement program right now, and that means that for people on Medicaid, the classic populations that have been covered by Medicaid, which is low-income people, people with disabilities, some senior citizens, pregnant women, and also that includes the Children's Health Insurance Program, CHIP, which covers working families that make too much to qualify for Medicaid, but not enough to afford private insurance on the marketplace or however it's sold in their particular state or whatever they're eligible for. So Medicaid and CHIP are really hand-in-hand programs, but the benefits under Medicaid are much more robust for children than CHIP. And so I will say that under Medicaid, believe it or not, and sometimes people are surprised to hear this, let me get to my one slide on EPSDT. Oh, oops, back. Oh, that wasn't what I wanted to do. Hold on, there we go. Is anybody familiar with what we call EPSDT in Medicaid? Not that you should be. So EPSDT, believe it or not, children who qualify for Medicaid have access to, and that's the key language, access to, theoretically, the best pediatric care in our country. Early and periodic screening, diagnosis, and treatment. That means that anything medically necessary, that means that children must be screened from the moment they're born throughout their childhood for anything and everything. And that anything that's deemed medically necessary, they must receive all treatments, medications, therapies, etc. Now, does that happen? No, it does not happen all the time. There are not enough providers. People sometimes don't know they're even eligible for Medicaid in some instances. There are lapses in coverage due to eligibility requirements or all kinds of bureaucratic red tape sometimes that knocks people off of eligibility. But it's amazing how much people don't know about Medicaid who are average citizens who aren't expected to know, because it has such a stigma associated with it, as if it's just for poor people, and that is not the case. I did pull up something. I think your best source of information about rare disease and the specifics in terms of coverage, like newborn screening and different drugs that are covered under Medicaid, are your local advocacy and your national advocacy organizations who specialize in that. But as I was preparing today, I came across something that what I found really surprising. I didn't know anything about this before. In terms of drugs that are covered under the Medicaid rebate program, the line extension program, is anyone familiar with that? When drugs are extended for a period of time for off-label uses, so they have a period of exclusivity during which they can still be affordable to people. And I guess there's been some discussion about extending that, and the Congressional Budget Office has estimated that if that were done, it would save $1 to $5 billion over 5 years in terms of medication costs, and people with rare diseases and chronic conditions would have greater access to that. So we're not just talking about spending money. We're talking about, as Mike has said throughout his presentation, spending money wisely and spending money effectively and advocating for that with your members of Congress. So I really strongly encourage you to, know what your organizations and your advocacy organizations tell you in terms of the legislation and the demonstration projects, pilot projects. A lot of what we're doing at CMS these days are demonstration projects to see if we can provide care more effectively, if we can provide greater access to care. It is not supposed to be a demonstration project to figure out ways to kick people off of care, which is something that's going on today in different states under the guise of saving money. So I would encourage you to really get as educated as you can by your advocacy groups and take that to your members of Congress. Do not underestimate the power of personal stories. Even though people don't necessarily make decisions on the basis of emotion, I have personally seen, since I worked in the Senate for a number of years, members whose votes changed because of visits from their constituents that finally hit home to them a situation that was only theoretical or academic to them before they actually met the person involved. And you all have the most power of anyone in this particular area of advocacy. So I really salute you. I thank you for coming to a heavy session on Medicaid and Medicare and a busy day. And we're here to answer any questions you may have. Thank you.